I'm Michael Murphy. I'm the Program Director of Respiratory Care. This is an 18-month associate degree program. We go 5 semesters. We don't do a summer break because we want to get people out into the workforce as soon as possible. We start off our practical training here in our lab, where we let students work with our mannequins and all the equipment we have in the lab so they become comfortable before they go into the clinical environment. In their second semester, they'll be starting with their clinical training. And we utilize Hartford Healthcare and Yale New Haven Health as our primary clinical affiliates. We also send students for extended rotations at Connecticut Children's Medical Center and also Hospital for Special Care, which is a long-term care facility where they get a lot of hands-on experience working with patients who have chronic tracheostomies or who are on ventilators for a long period of time. We have excellent job placement in this program. For the past several years, all of our graduates have had job offers in hand months before they graduate. They're graduating, going right to work. It makes us very proud when we see students following in our footsteps. Respiratory therapists generally work inside a hospital environment, acute care hospital, and our assignment can be routine floor therapy, administering nebulizer and bronchial hygiene therapy to patients on the general medical floors. We maintain a strong presence in the critical care areas, the ICUs, the recovery room, and the emergency department. If your hospital is equipped with a pediatric or neonatal facilities, you'll certainly get some exposure to those areas as well. If you're going to be a respiratory therapist, you have to be comfortable collaborating with other healthcare professionals. You have to have really good communication skills. You have to be able to make a case when advocating for your patient. It's not just respiratory therapists in the hospital. We're interacting with physicians, nurses, physical therapists, occupational therapists, speech therapists. So it really is a whole community helping the patient.